Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello, everybody, and welcome back. Today, we have Dr. Michelle Chestovich with us. Now, this is somebody that I have met in real life, and I'm so delighted to be chatting with Michelle this morning. I feel like we're kind of coaching sisters. We actually met at Dr. Kimia Saraf's trauma-informed coaching first, and we both trained in the same coaching school. So we kind of known each other for a while, but Michelle has some really impactful story to talk to us about, and I really am so grateful that she's here today. So I'm going to let you introduce yourself, Michelle.
Thank you so much. It is such an honor to be here. And I just love seeing your beautiful face and being a part of this, conversation for others, to impact them. So as you mentioned, we've met before, which is great. I am a fellow family physician. So I am in Minnesota and I trained here and I was a family physician for 20 years. One of my favorite things to say is I'm also a mom of 4. So I know firsthand the struggles of trying to balance motherhood and medicine. And while I love taking care of my patients, like it has just been a lot over the years. So I bring that story forward, to share as well, that if it's hard for you, yes, that makes sense. And it doesn't need to be so hard.
I love that. I love that. So tell us your journey towards family medicine. What enticed you there? What was it about family medicine that kind of, how did it go for you? What is family medicine like?
Yeah, so I am somebody who just loves all of the things. When I was younger, I just loved being out in nature and I loved science. And when we got to dissect the frogs, that was like my favorite thing. And I was going around the room, like helping everybody, showing them all the cool things. So I was drawn to medicine because of my love for science. And I also love engaging with other people. So I went into medicine just being excited and curious about everything. And so every rotation that I was on, I could imagine like, wow, this is so cool. This is so great. Oh my goodness, we get to help babies be born. So fun. But then interestingly, because I did think quite a bit about becoming an OBGYN, then I'd want to go and examine these beautiful newborn babies. And they would say, oh no, the pediatrician will come in tomorrow. And I'm like, wait a minute, we just worked so hard to get this little beautiful baby here. And so that made me that was one of my first thoughts that like, oh, maybe family medicine is for me. And I love variety. I've subsequently learned that like I, have a brain that is ADD and loves to like jump around to lots of different things. I love working with my hands and doing procedures. And yet I don't want to be in the OR all day. So for me, it was just a beautiful meld of variety and lots of different ages.
Love it. Okay. So
one thing that is really, really important. I believe in prevention. Right? So I love talking about taking care of ourselves and trying to prevent heart disease, for instance. Sure, I can help you treat that, but let's start from the beginning and taking care of families from a young age. That was great. And this segues into the work I do and you do now. Like, how can we prevent problems and create sustainable work environments?
Yeah. When you started in I don't know whether it would be residency or family medicine. How did it go for you? You mentioned ADHD brain. What did that kind of look like within your clinical day?
I loved residency because it's like I was really digging in. And I think that it was in some ways easy for me to jump to all the different tasks that I had to do. And then certain times when I had more space, like rounding in the hospital, probably in thinking back, that was harder for me because it was more like I was in charge of my schedule. Yet there was so much to do that I would just make my list, my little boxes. And so I could still follow along. Where it got trickier was I was out in clinic and my brain would want to jump to a different task. Yes, I've got the 15 minutes of my patients that helped me throughout the day, but then I'd come out of the room and my brain would immediately want to go to like check a message or check an email, something like that.
Yeah. What was the cost of that? Like, how did you end up having the day's work done? What would it
Yeah,
do?
no, it cost me a lot. Like I was, kind of your classic person that you help in that I was charting a lot at night and on the weekends. And I would come home and I'm like, oh my gosh, I've got hours of work to do. And my son was really little at the time. He's like, Mama, how many charts do you have to do? I'm like, oh my goodness. So like he would see me doing this and ask me questions like, I want to read a book. How many charts do you have to do? And so I thought this is not sustainable. And so
Mhm.
I looked into getting a scribe. So kind of the very beginning of scribes, I went to my organization, said, hey, I would like to try this out. And they were a little suspect, like, oh, I don't know. I don't know how the patients are going to think about this. And so they're like, well, if you want to pay for it, you get after it. But we're going to make sure we query the patients to see how they think this is working for them. So I loved it. The patients were fine with it, of course.
Mhm.
But then the organization's like, okay, you can keep doing this, and that's going to be on your dollar. So this is what I did though, because I'm like, I can't spend 20 hours outside of my work week doing this. So my husband said, do whatever you need to do.
Uh-huh.
Because the other option was for me to like go work at a bookstore, right? I'm like, I'm going to quit this job and go work at a bookstore. But he said, do what you need to do. So I hired a scribe for several years. And then eventually, as I got into coaching much later, I figured out strategies that were more helpful for me. But as a stopgap measure, I paid for a scribe to keep me going.
Interesting. So this is family medicine. There's a scribe. So where did you find your scribe? How did you train them? Like, what was that kind of, because that's a decent, I'm going to say it's a decent investment, but
It
at
was,
the same
I
time,
joked that it was half my family physician salary, but it really
it may
wasn't.
not be
But
a joke though, because it could
no,
actually be.
it was a fair amount of money. Initially, there was like a colleague who knew someone whose daughter was going to be going to medical school,
Uh-huh.
and she had done some of this work for her mom before, who was
Okay.
also a physician. So she was my first scribe. So she was just kind of
Yeah.
an independent young woman, very bright. And then after that, we found like a scribe organization that they would do the scribe training, and then I would kind of work with them how I like things, but
Yeah.
they're just usually very smart young folks who are often planning on going into medicine. So they're curious and eager to help you.
Yeah. Now, when you've got a scribe in the room, one is that you've got to kind of train them up to be on task with what you're doing. Then we have the objection that then there's this like you got to check on their notes and sign them off. When were you doing that? Was that in real time or at the end of the day? How did that work?
I'm trying to think back. I think I often did it in real time because they're
Hmm.
speedy typers. And
Yeah.
sometimes there might be a few that I would be checking later. Although, again, interestingly, sometimes I would push them all aside because, again, I had not yet started coaching. So I was just in the habit of pushing them aside. So now at the end of the day, I have all these charts to still review. So again, I do think that coaching is a magical piece of it to help us do it more in real time because I was pushing it aside. It was
Hmm.
quicker, but it was still work that I had to do later. So that's
Yeah.
interesting as I think back on that.
Yeah.
That wasn't the only solution for me. I still needed to learn other things, and I still have other tasks to do. I still have
Yeah.
messages and labs to deal with that. Again, I still struggled with all of that until I figured out some kind of coaching hacks.
Hmm. And the the one, identifying what you needed, two, investing in what you needed. I noticed that the organization said you need this, but we're one, suspicious, and two, not going to pay for it.
That's right. And I'm a little feisty. I got, mad and I was frustrated. And yet I'm like, well, this is the fact, right? Like if I want to stay in medicine, this is what I need to do, or I'm going to get even more burnt out than I already am. And I didn't think that that was a great idea. So I'm like, well, let's try this. If it keeps me in medicine and enjoying medicine more, which by the way, it did. Like I love going in and sitting down and just listening to my
Hmm.
patients. It's
Hmm.
so beautiful. And now there are so many more other opportunities with either virtual scribes and or the AI scribes, that sort of
Hmm.
thing. There are more opportunities for people to get that sort of support if they need. I certainly suggest at least experimenting with it.
Yeah, the experiment. It's so important. I remember I had wanted assistant to help me because there were care plans that we do in Australia that then allow our patients to access things like physical therapy, dental, cheaper. Like they get these visits. But I had a couple of hundred, and I had really done the work to make them really fast, but it was that additional burden of things that would be happening outside of the clinical day that I just didn't have the capacity to do myself. And I said to them, can I have an MA to help me? And they said no. And so I said, okay. And I didn't pursue, well, I could pay for one. Like it didn't, to me, that hadn't even registered within my resourcefulness of you can hire. And they never mentioned you can hire. And they probably would have let me hire somebody. And I've certainly done that since. Had a private MA for a while, just to, again, experiment, see what I needed. But right back at the beginning, that didn't even compute that I could just like try this out for myself.
Yeah, absolutely. And I'm not sure, but for my colleague who is also struggling, who said, hey, what do you think about trying this scribe? We will be paying for her. That was like, oh, yeah, that's a great idea. So for everyone listening, if you think, oh, they say no, no, there are, as you've said before, Sarah, like infinite possibilities, like
Yeah.
what might be helpful for you. Because if the way you're doing it isn't working, okay, let's experiment and try something else.
Yeah, yeah. Do you think that it added any additional patients to your day? Was there anything else that would change because you popped this other person into your day?
I probably was able to see a few more patients in the day. And overall, I just felt less overwhelmed because I felt like I had my buddy in the room with me to help me. I didn't feel like I was like tackling it all alone. So for me, that was helpful. And then I just wasn't getting so frustrated and upset when someone would come to me and say, hey, Dr. Chestovich, could we put in another patient in on your schedule? I'm like, yeah, no problem. I mean, seriously, it was that easy. It's like, yeah, not a problem. But when you're drowning and overwhelmed by all of the things, like I would probably burst into tears if somebody would come and say, you know, could we put another person in your schedule?
100%, of course. I get it because it's like, don't add anything more. I'm already
Yeah, no,
keeping.
like literally, I'm hardly keeping my head above water.
Yeah,
And now you want to add one more thing.
yeah.
It like, I was always at that very point of like, what's going to be the straw that breaks the camel's back this week,
Mm,
right?
mm-hmm.
Which is a
Yeah,
horrible place to be. And I was in that
yeah.
land of like near burnout and drowning for many times and up and down over
Mm,
the years, right? 4 kids
mm.
under age 6. What the heck was I thinking? I mean, it was a
But
delight, but like,
tell us what were you thinking? Like, honestly, go there. Like, okay,
well,
so we had little person and he's saying, Mama, how many charts have you got
yeah.
tonight?
Well,
And
at that
then,
point, I already had the others. So it was like too late to go backwards. And of course, I love all my kids. I had my son in my third year of residency, which was a
okay.
great decision for me
Uh-huh.
because it allowed my husband, who's amazing, to like have time with my son when I was in residency. And he would like bring my son to visit me when I was on call, so on and so forth. But then I said, like, let's go. I mean, I was 29, almost 30 when I had my son. I'm like, I want to have a few more kids. So let's get after it. So we
Okay.
kind of just rapid fire had a bunch more children, which was, again, always the plan. And I loved it, but it was a lot. And so when
Mm,
I'd come home at night after a full day in clinic and I had charts to finish and I have 4 little ones to like bathe and read books to and put them to bed, I love that time. Like that is precious time. And yet
mm.
it's challenging. So for people with little ones, you're like, oh my God, that's the crazy time of the day. Yes, it is. And it was still very special to me. And yet in the back of my mind, I'm going to get choked up thinking about this.
Mm.
In the back of my mind, I was always thinking like, I got to get back on the computer.
Yeah,
So I
yeah,
wasn't like locked in and fully present, which I
yeah.
hear from so many physicians. They come to me because I'm also a coach, and they come to me and say, I just want to right size my work. I want my work to be more sustainable. And I want to be present with my family when
Mm.
I'm with them. And I
Yeah.
totally understand that pain of my brain thinking about all the work I still need to do while trying to be with my kids.
Yeah, so this was, you're a resident, which is already a crazy busy time. Was this family medicine residency, or were you still in the
Yeah.
hospital when you had your
It was
son?
all, I mean, so in
Okay.
my residency is a 3-year program and we do clinic
Mhm.
and hospital, primarily
Right.
hospital based,
Yeah.
but
Yeah. Okay. So you've got one kiddo, then another kiddo. We've got to think about your human physiology, having babies and being postpartum.
oh yeah. Yeah, being exhausted, being sleep deprived, nursing, pumping. Like when I was pumping, I mean, oh my gosh, I'm all these like memories are coming up, like pumping and, you know, trying to keep up with like charting as I'm doing that. But
Yeah.
another thing I realized, because I didn't ask for this, my first kiddo in practice, I did not ask for time to pump.
Yeah.
I just did it during my noon hour.
Yes.
People, you can ask for what you need,
Mm.
right? I saw another colleague who put breaks in her schedule. I'm like, oh, you can do that? So for everyone listening who's struggling, think about what would be helpful for me.
Yeah.
And you're so good at this, Sarah. It's like helping people explore and think, like, just because it is this way doesn't mean that you can't create something different. And I tell you what, those little things, even just like a pumping break in the morning and one in the afternoon, is great. And if you're not lactating and needing to pump, that's fine. What if you needed a 15-minute catch-up time?
Mm.
Right? It is possible, people.
It is possible. Keep asking. I mean, sometimes you come up against a no, and now we have to kind of think a little differently, but at least ask for
Yeah.
what
The worst they
you
can do is say
think that
no, and
you
you're right
need.
where you are.
And it may not end up being what you need, and you have to kind of think again and redesign it again. But I think you're right, Michelle, that whole watching others, what are they doing? What have they asked for? What did they get? What do I need? What do we had our first when I was in sixth year medicine. So I was still at medical school with our first, and I was on the vascular ward, and I'm pumping in the patient change area. I didn't even ask if there's breastfeeding rooms. I just, just did what I needed to do. Threw it in a paper bag, put my name on it, put it in the
Right.
fridge.
Absolutely, because we just follow along. We see what needs to be done. And I do think that there's a little bit of a groundswell change in how things go. But for the
Mm,
most part, we're trained to just keep going, even when we're exhausted, which
mm,
again, now you and I, as coaches who are trying to help people create more sustainable careers, it's like, okay, so this is how it's been, but how's it working for you?
mm,
And if
yeah.
it's not working for you, if you think to yourself, I can't do this for another year, God forbid, 5 years, 10 years, then what can we do differently? You and I met at this FMX conference, which is a National Family Medicine Conference last year in DC, which was fantastic. And I talked to all these young, physicians who were walking by, including people who are just out of residency. And I would say to them, how are things going? And
Mm,
tears would burble up in their eyes. They're like, I don't know how much longer I can keep doing this. And I just started.
mm,
And that just
yeah.
breaks my heart because we need good, amazing physicians taking care of all of us, right?
Yeah. Yes, agree. So you mentioned that coaching was helpful for organizing some of the aspects of your clinical day. Talk us through that. What was that like? How did that start to impact you within your day?
Yeah, I was that classic person who would get a little bit behind and then be so stressed out that the next person's waiting and they're going to be angry at me that I just kept going and I just kept piling up the work for me to do later. So with
Mm,
coaching, I learned that I have my brain and I have thoughts that create my feelings and that other people have their own brains that do the same. And so no matter how I behave, they may or may not be happy with me. I was like, oh, what? Right? Because as a woman, I've been sort of socialized to people please and make everybody happy around me. And so it's not that I all of a sudden became some like narcissistic a-hole that only cared about myself. Of course, I cared about my patients, but it made me realize it is okay for me to finish my job and finish my encounter before I move on to the next patient. And
mm,
that like changed everything for me. And I can set boundaries with patients. I can say like, oh, wow, that sounds really important. I would love for you to come back for that. Whereas in the
mhm,
past, I thought that was sacrilegious, right? Like I can't do that. Yeah, you can. And so just those few little changes, realizing like I can empower myself to make some of these changes. And some people might not like it. And that's okay. Of course, we want everyone to love us. I get it. It doesn't feel great. But this is my life too. And if I'm spending hours at night catching up, this is going to be unsustainable and I'm going to quit my job.
mm.
Right. And that's not good for the patients either. And that just some light bulbs went off. Like, how can I make this smoother? How can I make it better?
Nice. Okay. So there were some decently big changes that happened, but it started from the inside of you saying, I'm going to let myself do this. It's
Yeah.
okay to do my
It,
job, to finish my job for this patient.
yeah. And it
And
took
then I'll
what?
go attend to the next one.
17 years in medicine to give myself that permission, right?
Mm.
I had 17 years of always the patient comes first, the patient comes first, which like, yeah, sure. If they collapse on the floor, yeah, let's get after it. Let's help them. They do come first in this situation. But just because a patient has a scheduled appointment at 9:30 and I'm running a bit behind doesn't mean that I can't complete my encounter before I move on to them. They can wait a couple of more minutes. It's going to be fine.
Did this happen like overnight?
It did not happen overnight. That's a great question. But for me, when I understood that like there's the way I think and feel about things and that I can't control other people, like that for me was pretty, it was a huge aha, like,
Mm.
oh, so that kind of came quickly, trying these little things and setting boundaries. It was like baby steps for sure.
Mm.
But just that realization of like, no matter what I do, because then I started to even gather evidence that this was true. Like I can show up right on time. I can really listen and deal with all of their problems. And the patient could still be like maybe a little discontent.
Mhm.
Interesting. It's almost like they have their own thoughts about whatever it is that's going on.
Yeah. We somehow want our patients to time keep. Like they've got some idea of how long this might take and how many things to ask for that is appropriate. Like we have all these expectations that the patients have no idea how long their appointment's for, how long it takes us to do headache or script refills. Like they have zero insight into that. But we somehow expect them to be reasonable in their requests.
Yeah. And then we get mad when they're like, oh my gosh, I can't believe they brought in all of these things. Well, of course they do. They're coming to the doctor. They want to deal with all of the problems. It makes
That's right.
sense. And sure, they can ask for all this, and I can be the keeper of the time, right?
Yeah.
To your point, it's
Yeah.
brilliant.
Yes, yes. So, so helpful. So you're starting to be curious about where your time's going. You're curious about the way you're doing your work. You're noticing you don't like later, which I think that is an important step in why do I want to make change? Because change is hard in our day.
It is hard, but the pain of working on I especially, I remember sitting at my kitchen table on Sunday afternoons and my family's all playing in the backyard and someone would keep popping in, Mom, when are you going to come out and join us? Like
Mm.
that pain was so great
Yeah,
that I was willing to try some different things.
yeah, yeah. So
But you're
good.
right, it's a little uncomfortable, and especially having somebody wait. But again, as a coach, I talk about this as well. Like, yeah, it's uncomfortable having somebody wait, and it's uncomfortable charting at 10 o'clock at night. So, like, you get to choose your discomfort.
Yeah, you get to decide which one you want.
Right, right. Just like we tell our little 3-year-olds, do you want to wear your jacket or carry your jacket? You choose.
Love it, love it. All right. So what's happening then? What happened? So you've changed up a few things, you've become a coach, you started helping things. Tell us more. What else?
Yeah, so coaching helped me so tremendously that I thought I need to become a coach because my people don't know this. I need to yell it from the rooftops. Hey, everybody, it doesn't need to be so hard. There are some
Mm,
very simple things you can do to gain back control. Because we high achievers try to control everything around us in order to feel good. We manipulate all the things, we work harder, work longer, and it's exhausting. And so I felt so much better. Like finally, coaching felt like I had a big life jacket on. I'm in the water, I'm still swimming, but I didn't feel like I was drowning at all anymore.
mm,
So I became a coach, and work is really fun again because I have these tools. I'm getting my work done during the day, and I'm coaching on my days off. Because I started a coaching practice. I'm like, this is amazing. I'm doing more than ever, and I'm
mhm,
feeling less stressed out than ever. So, like, that can also be true. Right. So I really,
mhm.
really loved that. And I started coaching more and more. My coaching practice was building. And then I realized, oh my goodness, I'm like coaching at my noon hour in my car now at work. And
Yeah,
so it was starting to become like a little bit much, even though I
yeah.
was still having a lot of fun and enjoying it. I decided, you know what? I think I'm going to segue and really just put all into coaching. And another thing that happened during this time was that unfortunately, my family suffered tragedy in that in 2021, March of 2021, my baby sister died by suicide. Um, Dr. Gretchen Butler was a radiologist at a level 1 trauma center in Minneapolis. And we had no idea that she was struggling, right? It was the 1 year into the pandemic, and we had no idea that she was struggling so tremendously. And, of course, it was a combination of sleep deprivation, postpartum anxiety, some harassment and things like that at work. It wasn't just one thing, but her death just rocked my world. And I'll never forget, I spoke to her 3 days before she died, and she said, I am so exhausted. I have a headache. I'm nauseous. She'd just come off like a 36-hour call weekend. And I said, sweetie, you got to call in sick tomorrow.
Yeah.
And she said, I can't. We're short at work. And she said, I'm just feeling so burnt out. I'm going to have to find something different. And it was the first time I had ever heard her say that.
Mm.
And then after she died, I thought, holy buckets. I had no idea that she was struggling because she was the award winner. She got all of the awards. Everyone thought that she was the best, the patients, the staff, the residents. And I realized that she's not alone, right? I mean, in that a lot of physicians are struggling and that we're really good at hiding it. And then the big thing that I realized after she died was that we lose 300 to 400 physicians in the US every year to suicide. And I thought, people don't know this, and people don't know that it's okay to get help. So after she died, I realized I need to do even more work, right? I need to raise awareness and help more physicians get the help that they need to stop the stigma. So I really appreciate this opportunity to even talk about it. We need to stop the stigma with mental health issues, right? We talk about heart disease, we talk about our kidneys. Let's talk about our brains. And we physicians are at high risk.
Yeah.
So I just think that it's all the more important for us to create jobs that are sustainable so we can have time to take care of ourselves outside of our jobs.
Yeah. She had said, I can't take a day off. Tell me more about, because you hear this now when you're talking to physicians who are describing their burnout. Tell me about that mentality.
It's really hard because I just want to stomp my foot and say, yes, you can.
Mm-hmm.
This is your life. For her, the call schedule, it was in March, but the call schedule had already been set for the whole year. And even that was causing her some stress. She had asked for some particular holidays off and, and religious holidays, and she didn't get them. And she was just seeing like, this is the way it's going to be all year. And yet what I will tell you, people, is that they figured it out. She unfortunately took her own life, and the call schedule was completely disrupted. And of course, her colleagues were devastated, and yet they figured it out. So we are important as team members, and yet we too are human. If you're sick, take a day off, right? If your kiddo is sick and you need to be home with them, sure, other people may have some thoughts about it, but this is your life, and people can survive without us, right? And again, I'm not saying that like we're not important. We are, and yet we're not so all important that we can't take time for us. We all have these horror stories, and I feel like it's lauded in medicine. Like, oh, that time I worked when I had a fever, was sick and rounded, and when I was like throwing up. It's like, we need to stop that. We need to stop like emphasizing and thinking that you get a gold star because you work when you're exhausted or sick. It's ridiculous. So back to your question, what do I say? I say, stop it. You can take time off. Yes, it's going to be uncomfortable for you because we worry so much what other people think, and yet they'll figure it out.
Yeah. I've heard many physicians get to the point of physically unable to work, hospitalized, at worst, like your sister, suicide. It's so important to acknowledge your own humanity.
Yeah, that's exactly it. We too are human. Yes, you're trained exceptionally well and you can take care of people, but we've been trained in the system where you're supposed to just keep going and not care about yourself. And that has to be right-sized. If we want to change the culture of medicine, it starts with us standing up and saying, hey, you know what? I'm sick today, and you're going to please need to call my patients and reschedule. And that's hard. I'm not saying it's easy, but that's where we need to start making these steps to be the ripple effect that needs to happen.
When we're working and we're not well, like you said, we are so trained to put off our own humanity. We bring the game face, even though we can feel like a shell on the inside.
Yeah.
Just a
And
shell, like
we
empty
do
on the
feel like a
inside.
shell, and then we berate ourselves. So I've been there. Like, I'm doing all of the things and I'm so exhausted and I feel like I'm dropping balls everywhere. So I used to cry myself to sleep thinking I'm a horrible mom. I'm a horrible doctor. I'm not a good wife. I'm not a good sister. And so, like, I thought that was like the worst of it, right? Just crying yourself asleep, beating yourself up because I think, what's wrong with me that I can't handle it? No, it's because we're trying to do way too much. So I'm going to need to learn, right? And I did learn. I can start setting boundaries. I can start saying no. I can start remembering, oh, I am human. Even though I'm a physician, like, that's great. That's just one piece of me.
Mm. Mm.
Yeah, it's really sad and scary to think about how many people are just hanging on by a thread. But again, putting on that game face, everything's fine.
Even I think sometimes people don't want to reschedule the patients, take a day off, because then on the return, they've got that constant drip of, why did you need a day off? Or I can't believe you rebooked me, or I'm so mad at you for not being there. And you hear it when they come back from maternity leave. The patients are mad at them for having had a baby. And
Yeah, they
they
are,
have
because
their own comments about you and everything about you. You're not, you look tired today, can even be a triggering kind of suggestion from a patient. More like a judgment statement from a patient. And so I don't know if that's an additional layer of reason why you might not want to take yourself away from.
oh, 100%. And you're just going to berate yourself. I mean, a lot of times I think it's just a lot of self-criticism. Like, yes, other people are going to have comments, and I don't want to put up with my colleagues or whatever. Like, I think there's a lot of like gaslighting that goes on, like, oh, you're not a team player kind of garbage. But yeah, the patients make comments, but I think we're our own worst critic. You should be able to figure this out. Why aren't you doing better? Why do you, whatever your brain says to you, most of us are very self-critical. And I've learned over the years that that just doesn't help. Like, it's bad enough to be sick and to be exhausted. So how can we give ourselves just a little dollop of self-compassion? But I've had to learn this, right? I didn't even know, hadn't even heard the word until probably age like 45. So I've had 5 years of practice that I can say this out loud and not like gag, right?
What do we do with that? Like, if I mean, so we've got a patient and they have a comment about us that we're kind of immediately internalizing as a judgment call about us. Because I hear this over and over in the Facebook groups. They call me by my first name. They tell me I should smile more. They have a comment about my dress, or what I'm wearing for the day. My colleague wants to know why I need another weekend off this month. Like, what do you think that coaching taught you that would be helpful to kind of understand that
Yeah, it just
in
helped
real
me
time,
realize.
and how to handle that in a way, or at least notice what we're doing about that?
Yeah. Well, number one, I just want to acknowledge, like, it doesn't feel good to like have something that we take personally, right? Because of course we want everybody to love us. So I think, again, I've learned self-compassion just to like realize, like, oh yeah, this hurts. And I also really acknowledge that like other people have their own brains, and it's okay that they have different thoughts and feelings than me, right? Like, I am not everybody's cup of tea. I do the best I can. And no matter what I do, it's like not everybody's going to love it. But just to acknowledge, I don't like to, be toxically positive and say like, oh, just don't worry about it. Cause like it does affect us. I just on this week on my podcast talked about patient satisfaction scores and how
Yes.
that really affects us.
Yeah.
And that hurts. Like, I remember seeing this note from a patient saying, Dr. Chestovich is a travesty of a physician. I'm like,
Oh.
are you kidding me? Like, this totally rocked my world. It was just a disgruntled patient who didn't get antibiotics for her chest cold. But at any rate, it still like ruined my day. So I think
Mm.
coaching has allowed me to realize, like, yes, it hurts. And how can you take care of yourself? And it's okay that people have different thoughts because they're just viewing the world differently. And it's really more about them than it is about me. And I've learned to self-validate. We physicians have gotten all the beautiful external validation in our life, the gold stars, the A's, the, oh, thanks for being such a great helper, ever since we were little, right?
Yeah.
And so we love all those accolades. Of course, that feels really good. But now all of a sudden you're out in the real world and maybe people are saying things that are less than ideal, not the gold star. But when we learn self-validation and realize, like, I'm a good physician, I take good care of my patients, I listen, I come up with a great diagnosis and a plan. And I did that work on the regular. That is what allows me not to get so upset when other people have these thoughts. It's more easy for me to put that back on them, like, oh, that's their opinion. I know the truth. So it,
Mm-hmm.
again, it's not overnight, but I feel like learning how to create those own beliefs in myself and make them really strong makes all the difference.
Mm. Yeah, when I was looking back at me in that craziness of family medicine and, don't ask me to do any more. And that one of the very first pieces that I learned was the giving my power to somebody else and that's not required. And what I mean by that is if Joe has an opinion about me or brings 10 items into the room and I get frustrated and I want to go tell my colleague about it and I want to I want to hide it because why would I tell somebody that somebody doesn't like me or something like that. What I'm doing is I'm saying, Joe, how about you just determine how I feel for the rest of the day?
Right. I did that
and
all day
and
long.
when I realized that, I'm like, I what? I'm letting him determine how I get to feel about my day. Well, I don't want him doing that. I don't want him being the decider of my happiness or whatever. Like,
Yeah.
I was so mad about that. And then I'm like, right, this stops now.
Yeah, I'm going to take back the power. Oh, this is my job, right? And again, it
Yeah.
all started with just that basic framework that you and I learned in our coaching is that the way we think creates the way we feel. People
Yeah.
don't throw frustration on me. No, I create that. Just my beautiful, well-worn pathway in my brain goes to frustration and annoyance a lot.
Mm-hmm.
I get to be the one who's in charge of changing that, which to me was so, oh my gosh, I need to learn this. I want to learn this so I can gain back control and not feel overwhelmed and frustrated all the time.
Yeah. I mean, even the looking at the schedule ahead for the rest of the year and having that feeling of trapped. Think
Yeah,
that if everything, if we can step back and say that's a schedule that's been made, but doesn't have to be the schedule that happens.
absolutely. And or one of my favorite things when I first start working with somebody is like, okay, they get nauseous, they open up their computer, they see their schedule. And I'm like, okay, let's take a step back. Like, what are the facts? We docs are really good at this. What's the objective thing? Okay, there are 25 patients on my schedule today. Okay, now what do you want to think about that? Versus, oh, this is just because again, our brain has a automatic response of like, for many of us, oh, this is too much, or I'm not gonna be able to do it, or whatever it is.
Mm-hmm.
Which is like, okay, thanks, brain, for trying to protect me. And yet, what are the facts? That's just like such a simple thing, for your listeners to think about. Like, okay, what are the facts of my day?
Mm-hmm. Yeah. I have a lot of physicians who are fully booked ahead of time for the next 5 months. So they feel completely trapped by that. It feels like, it could feel like there's no flex here.
Yeah, but like you could be the decider. Like, actually, you could make some changes.
Mm-hmm.
Yeah, but it's going to be a little bit uncomfortable. And keeping it the way it is also uncomfortable.
Mm.
There's always an option.
Yeah.
I love that. I think it's really important. We're such polarized thinkers, black or white thinkers. It's this way or that way. It's right or it's wrong. Like, wait a minute. What about all of the beautiful other things?
Other things in the middle. Tell us about your work in breaking the stigma around mental health and our ability to discuss our mental health with each other or getting help for our mental health. What is some of the things that you've been working on?
Well, it all just started with like my sister was amazing. I come from a family of, there were 4 kids, we're all physicians, and she was the youngest, and she was just incredible. So we all admired her so much. I mean, I admire all my siblings, but like we all just admired her so much. She just had a beautiful knack of like things came easily to her. She worked hard, and yet she was very athletic, very academic, very social, like all of these amazing things. And when she died, my family decided right away, we're going to like say what happened. Like even in her obituary, Gretchen died unexpectedly by suicide. Name it. Like, how does this beautiful young 36-year-old woman die? Well, this is how she died. And she had an amazing husband and 3 beautiful kids that she loved more than anything, and a family that loved her. So right away, we just like put it out there. Like, we are not going to be embarrassed or ashamed of the fact that this poor young woman had a brain that was so sick. So that's sort of where it began. And then I need to be the messenger to share the word. Like, I work with physicians, and I don't think that they know that they're at risk. Physician women are 2.5 times the risk of dying by suicide than our non-physician peers. Like, that's extraordinary. So we need to start talking about it, right? Like, we talk about like, oh, my back hurts. Who's your favorite sports physical therapist, right? Why are we not talking about like, oh, who's your therapist that you see for anxiety, or what's your dose of sertraline? Like, why are we not talking about that? Because again, there's been stigma in the past. There's been a lot of like board authorization questions that we need to answer that, by the way, as an organization, as a nation, we've been doing a better job about that. But even like credentialing, like, do you have to answer the question, have you ever had like a mental health issue? Like, it's absolutely ridiculous. We don't say like, have you ever had diabetes that has affected your day? Like, we don't ask that. So why are we asking that about mental health issues, right? And so I just think that we need to talk about it. I've been at conferences and women are on the beach talking about like, oh my gosh, my like uterus is hanging out. Like, wow, we feel comfortable talking about that. Why are we not talking about our brain? The brain runs the show. If the brain is not healthy, like nothing else really matters. And so I'm just very passionate about saying like, we need to stop the stigma, start talking about it, start talking about the fact that we're human, and that of course we have a lot of stress. And back to how we met, like we deal with trauma on the regular as physicians. So how do we process this? Most of us just shove it down, and it swirls in our brain and swirls in our body. And that is not healthy. All of that unrelenting stress and trauma makes us more prone to having mental health issues. So let's just normalize it. Again, as a preventive doc, I'm like, okay, let's just normalize the fact that nobody's doing okay. And so now what are we going to do about it? And even before we started recording, you and I were talking about coaching and how it was so beneficial. I'm like, this is an evidence-based solution for burnout. We know we have a huge epidemic of burnout. Why is this just not part of joining the organization? Welcome. Here's your parking card, your badge. Here's your coach that you're going to be meeting with twice a month. Like, that's my hope, is that we get there. And it's the tip of the iceberg. People are learning more and more about it. But I think we just need to normalize that, like, yeah, we're humans with brains. And how can we optimize feeling better and not be ashamed about the fact that, like, I had a bad outcome? And yeah, of course, I need to talk to a therapist about that. Just normalize it.
Yeah. So those mums out there who are, pushing down those feelings and crying themselves to sleep because I feel like I'm not winning on any like platform. I mean, who are you talking to? Who's your person? Who knows what's going on for you? Because it's too dangerous to hide it.
Yeah, it is too dangerous to hide it. And yet most of us do. And I'm even thinking about myself. Like, I just cried and fell asleep and got up the next day and like, let's go again. Let's do better.
Yeah.
And so like, find somebody, a colleague. And, Brene Brown talks about like leading with vulnerability, right? And so even just saying like, wow, this has been a heck of a week. How are you doing? Right? Even just to open with that to a trusted colleague, you'll be amazed at the floodgates that open, to realize like, oh, this is a safe place. I don't have to pretend like everything is perfect. So find at least that one person.
Yeah. Yeah. And that can be what coaching does for people, is just a place to share your stories and have commonality, right? A place to be heard. And it can be that simple. It can be the reframe, but it can also be the connection. It's not that the idea is don't swallow it down, push it down and hide it away, but find that source of help for you.
Absolutely. And it normalizes it. You have a group, coaching. I do group coaching for physician women as well. And yes, they're going to learn a lot of tools. That's going to be amazing. But one of my favorite things is just bringing all these physicians together who think, oh my gosh, I'm struggling. I'm the only one, to normalize. Oh, everybody here has very similar and some different struggles. And that's okay. We all still can love one another, support one another, and learn ways that it doesn't need to be so hard. But just, I love setting the playing field of like, nobody's going through life without struggles.
Yeah. Yeah. And you're not burdening somebody by telling them that you're struggling. Like they want to
Right.
help you.
100%, particularly, family and friends. If I had any inkling that my sister had been struggling as tremendously as she was, like I would have done anything. Like, do you need me to quit my job? Do you need me to like donate my kidneys and my eyes to you? What do you need, sweetheart? Because I'd be happy to go on dialysis, right? I mean, that's a bit extreme, but like when someone is hurting that badly, there are a lot of things. But to step it back, even just saying like, hey, I'm having a hard time right now. Would you be able to like listen or whatever? People want to do that for you. And yeah, and you can be that person for someone else too. But I think just to normalize and open up that dialogue with colleagues and friends is important.
So good. Michelle, where do people find you if they're interested in learning more about what you do?
I have a website, www.mamadoclifecoach.com. I also have a podcast that is called Remind Yourself, and that is on any listening platform. And that's where I share just weekly tips on how to deal with the stress and struggles of, being a physician, dealing with time management and trying to help you find that elusive work-life balance that we're all searching for.
Perfect.
Oh, I'm also on Instagram, right? Mama Doc Life Coach. If you're an Instagrammer or Facebook, I'm there as well.
Beautiful. And anything we didn't talk about that you wanted to leave with our listeners or somewhere that they can get started?
I just would love to leave with normalizing. If you're struggling, you're not broken. You're not alone. There are so many physicians who are struggling. And it's just because we're high achievers and we think we need to do all of the things. That's how we've always done it. And the coaching can really be beneficial. But first of all, even if you don't want to jump into coaching, like talk to somebody about it. It's totally okay. Let someone know that you're having a hard time. But again, for me, coaching was very beneficial. I know for you too. The work that you're doing, Sarah, is just, it's saving lives, right? Like people are feeling okay to reach out to get help. So I think to just normalize that this is a way that medicine can be more sustainable and fun. There's nothing better than working with somebody who comes back and says like, wow, I'm finding the joy in medicine again.
Yeah, exactly. Love it. Good. Thank you so much for this conversation, Michelle, and for your vulnerability with us in this space as well. I appreciate you.
Thank you for the opportunity. I appreciate you as well. Thank you, Sarah.
Bye, everybody. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.